This video is on the subject of the Mental Capacity Act. It's a subject that's been on our radar for a couple of months for a couple of reasons. Before Christmas, somebody approached Stripey Lightbulb CIC and asked if we could consider creating a standalone training course on the Mental Capacity Act, as there are issues within the MECFS community that link to the Mental Capacity Act. So I spoke to my board, two of whom have working experience of the Mental Capacity Act as healthcare professionals, and we spoke about it in our board meeting. And they said, but training already exists. All we're going to be doing is doubling up on the work and the resources that is already available. The issue is the misinterpretation of the Act and the application of it. It's not necessarily the training on the Act that has to improve. So we are not creating a training course because we're literally reinventing the wheel. However, later on this year, we will be creating a webinar on how different interpretations of the Mental Capacity Act can cause difficulties for people living with MECFS and other chronic illnesses, and also the application of it, because it's the interpretation and application that's where the issues lie. It's also on our radar because in the last couple of days it's been mentioned within the Assisted Dying Bill committee hearings, footage of which has been circulating on Twitter. I'm just going to show you some of the things that have been said in the last couple of days about the Mental Capacity Act. Here, there's just one tweet. I don't know who this person is, but he's talking about the assisted dying discussion yesterday, I think it was, or the day before. And he says, the Chief Medical Officer, England, was confident about doctors knowing the Mental Capacity Act inside and out. The awkward thing is he got a key piece of detail about the Act wrong. There is a sliding scale of capacity, but that's not in the Mental Capacity Act and it's not in line with case law. So the extract he's put here, let me see if I can scroll up so you can see it. I'll just read out the highlighted bit. So it says, there is an absolute expectation within the Act, for example, that the more serious the discussion, the greater the level of capacity that someone needs to have. And then further down, someone says the Mental Capacity Act lays down some general principles, but the sliding scale is not mentioned, and I looked in vain for it. So it is got an extract from this link, legislation.gov.uk, so it is a valid link. And it says the principles. 1, the following principles apply for the purposes of this Act. 2, a person must be assumed to have capacity unless it is established that he or she lacks capacity. Now, this is kind of where my knowledge sits, that you, as a healthcare professional or a social worker, you have to assume the person in front of you has mental capacity unless proven otherwise. 3, a person is not to be treated as unable to make a decision unless all practicable steps to help him to do so have been taken without success. A person is not to be treated as unable to make a decision merely because he makes an unwise decision. That number 4 is particularly relevant with MECFS. An act done or decision made under this Act for or on behalf of a person who lacks capacity must be done or made in his best interests. And 6, before the Act is done or the decision is made, regard must be had to whether the purpose for which it is needed can be effectively achieved in a way that is less restrictive of the person's rights and freedom of action. And then one final thing. A very recent High Court case states the point rather differently. There is no sliding scale of capacity, but the decision maker needs to be more certain of capacity for more serious matters. So to read out the yellow text, it says, I am, however, equally concerned that the case law suggests that when a court is considering capacity, the more important the decision, the more careful the court needs to be that the person in question has capacity, as well as being particularly careful that they can give informed consent. bit that I said this is particularly relevant with ME, In many cases, just the ones that we know of, when someone is a severe patient is in hospital and they're given choices, as in, they might be on the point of starvation, malnutrition in a hospital. And when that person says, I would rather go home than stay in hospital, it's because that person understands their illness more than the person that is treating them in the hospital bed. They know that the longer they stay in hospital, the worse their ME is going to get. So if the hospital are not providing them with appropriate and adequate treatment, why would they stay in hospital to deteriorate? I'm smiling, but I don't know why. It's actually happened to people in our community. They would rather go home because they know there is no appropriate care. But if you are the person assessing them for mental capacity, you would think that was an unwise decision. It doesn't matter that it's an unwise decision. The point needs to be made that that person has mental capacity, just because they're not making the decision that you agree with, that you want them to make. I think that's where the difficulty arises. So I spoke to Southampton University this morning about various things, and I mentioned the Mental Capacity Act as part of our conversation, and they've pointed me in the direction of training for healthcare providers. So I'm going to now signpost people to that training. I'm going to show you it now. This page, by literally Googling, other online search platforms are available, I Googled e-learning for health. And it came up with e-lfh.org.uk, and it's supplied by NHS England, and I literally typed in Mental Capacity Act and it came up with a number of results, foundation programme, e-learning. So I had a look at this link here, updated Mental Capacity Act e-learning, now available, and these are the things that are covered. Hang on, so the programme page goes into things such as, so it's got 12 e-learning sessions. I'm happy to promote this because I'm pretty sure most HCPs are doing this regularly. Like I say, I think the problem is to do with interpretation and application. But this training is free and it's open for anybody to do. So some of the things that are included: Mental Capacity Act as part of human rights, assessing mental capacity, planning ahead using the MCA, best interest, restraint, deprivation of liberty. That is also something for our community to be concerned about. Quite a few of our members have been sectioned inappropriately because they're accused of having, well, not accused, but they're thought to have anorexia when actually it's malnutrition and they want to eat, they just can't. Relationship between the Mental Capacity Act and the Mental Health Act, Mental Capacity Act and young people, etc., etc. You can see it all there. It says each e-learning session will take approximately 20 to 30 minutes to complete. So I would encourage any HCP to do a refresher and to learn about the Mental Capacity Act if you haven't done so already. Healthcare professionals that I've spoken to have said that all, if not the vast majority of HCPs have done training on the Mental Capacity Act. However, yesterday, during the assisted dying bill, it was said that not as many people as should have done the Mental Capacity Act, which is why I've just signposted you to free training. Please do it if you haven't done it at all or recently. Update your knowledge. So in terms of what we're going to do, like I say, we're going to use case studies of how the interpretation and application of the MCA has negatively and wrongly impacted people within our community. Now that's going to be coming in the next 3 months or so. Please do keep your eyes peeled if it's something that you're interested in. Like I say, it won't be a training course like we've got for ME. It would literally just be a webinar on how it's applied and the difficulties that have arisen because of it. Because I think because you think someone is making the wrong decision, it does not mean that person hasn't got mental capacity. That's why I would encourage anybody to do Stripey Light Bulbs training, because if you do not know how ME presents in a person, if you do not know how healthcare admission to a hospital would impact someone with ME, of course you're going to think that person wanted to go home because you haven't got appropriate treatments for them. That wouldn't make any sense to you if you didn't understand how ME presented and just how bad ME can be. Anyway, so there we go. That's an update from us. That's some of the work that's going to be coming your way within the next 3 months or so. Please do get in touch if you have ME and you have lived experience of the Mental Capacity Act not being applied appropriately, or it's been interpreted wrongly, because I think highlighting misinterpretation and inappropriate application is the only way that we can improve how it's applied to our community. But yeah, okay, have a good weekend, everybody.